Hello, and my name is Dr. Hasan Abid, and I welcome you all to the JQSH Editorial Fellows panel on this special panel about Patient Experience Week that is being conducted by Global Journal on Quality and Safety in Healthcare. And today we'll be focusing on patient-centered healthcare from patient experience and moving from patient experience to human experience in healthcare. I am honored to be joined by my co-fellows from the editorial fellowship at the JQSH, and I want to welcome them and introduce them. We have Augustine Kumah, and we have Dr. Passant, and we have Dr. Ahmed joining us in this very interesting and appreciative panel on Patient Experience Week. So without any delay, let's move forward and let's ask some interesting questions to our JQSH fellows around patient-centeredness and how we can improve patient-centeredness in the context of healthcare quality and safety in healthcare systems. So I would like to begin with Dr. Augustine by asking him to kindly introduce to the audience about what is the patient-centeredness dimension of healthcare quality. Dr. August.
Great. Thank you so much. So patient-centeredness dimension of quality care, it's very important for us now in healthcare quality. It focuses on the importance of patient safety, which has to do with how respectful and responsive we are in terms of delivering quality care. It has an element of timeliness, which focus keenly on reducing the wait time or wastage in the system, and also helps in preventing patient harmful events or delays as well. Patient-centered care aims primarily to enhance patient satisfaction, improve quality of life, and promote functional well-being of patients. So it's key for us to prioritize patient-centered care because there is a need for us to ensure that the health system can better meet the diverse requirements of patients in the healthcare delivery system. Thank you.
All right. And Dr. Augustine, as a clinician and frontliners, right, we always think about how we can, improve at that very micro system of the work that we have, how we can really improve patient-centered care when it comes to day-to-day provider interactions as a clinical providers in healthcare settings.
Yeah, so when we are focusing on patient-centered care, it means that we need to be intentional about what we are doing in terms of what the focus is, what we are looking at as clinicians, and what are we contributing to the system to improve the safety. So when you look at the next slide, which has to...
Okay, so I'll try to move it to the next slide. Ahmed, can you do that?
Yeah, so when you look at this slide, for example, there's key focus on how we are ensuring that we are cultivating that patient-centeredness amongst the clinicians in terms of the relationships that they build with patients, the mutual respect and understanding that they have. The other way we can focus on this as well is to improve on patient decision making, which keenly we need to look at how we are respecting the preferences. Each patient, we need to understand how their individual needs and preferences. How do we respect that? How do we involve patients in the care and the decisions that we take? So it's a responsibility that we need to put on ourselves as clinicians to always ensure that whenever we are thinking of patient-centeredness, we are looking at the preferences of the patients, we are looking at how we are promoting health, we are looking at the communal the togetherness in terms of how we come together to improve the quality of care, having to do with all the dimensions that have to play and the role we need to play as individuals to ensure patient-centeredness is always ensured in the service delivery system.
Well, thanks a lot, Dr. Augustine, for highlighting that. Um, Now, moving from that individual microsystem-based work that we do as clinicians, I want to take the context and touch base at how things happen when it comes to uh, applying some strategies or improvement methodologies on improving patient-centered care. And especially nowadays, there is a focus on co-design. I would like to ask Dr. Ahmed Newera about his experience and then how he thinks that experience-based co-design, which is gaining rapid popularity in terms of an improvement method for patient-centeredness, serves as a core strategy across healthcare systems. Dr. Ahmed.
Thank you, Dr. Muhammad, for your nice introduction, and thank you, Dr. Augustine, for your nice introduction about the patient-centered care, which really we nowadays it's a core center of the healthcare system now. So what we're calling now is the experience-based co-design, which has the aim idea of take the life experience from the patient and their families and the healthcare provider throughout each stage of our improvement cycle. It's very important now to take input from the patient and their families as a valuable partner and shaping the new healthcare system or redesigning the healthcare system. It's not only by optimizing the process to enhance them, but it's crafted experience and take what was bad in their experience and to try to modify it in our current process in the hospital. And it's showed that it's very effective. When you bring the patient and the family and the macro level and make them put the plans in the hospital even more in the level of the ministry, their input are very valuable and really it's improved because they have a different perspective and different view for the healthcare regarding their experiences, not only just the one who's as a physician or healthcare worker, we are just providing the service. We don't know the perception of the patient. And there is a framework is here that for what we called it the experience-based co-design. Starting by the setting up, we have to establish a team by all the stakeholders which are involved in the process, and then engaging the staff and gathering experiences by observation, by focus group, by interviews, and then after that we have to make prioritization by the team and feedback events, and then after that engage the families and the patient and their families and see the touch point, the positive and the negative feedback from them, by doing interviews, by doing surveys, and by doing what's called patient journey mapping of the start of the healthcare journey in the hospital till the end of the journey. And then we have to make a prioritization of this touch point and see what is need more intervention and what is need less intervention. And then we have to co-design and redesign our hospital system according to this touch point and make solution and get their input by do mixed group by patient, and this is what hospital do nowadays. They bringing patient, putting them in the hospital teams and hospital committee to take their input and in the co-designing system. And after that, we have to do celebration of event to see what we have done and the plans we have done, and then go to the next stage of the improvement of experience-based co-design.
Well, thank you very much, Dr. Ahmed, for highlighting this in a very short and a very brief manner for our audience and colleagues in quality and safety to hear what experience-based co-design process looks like. And really, it's about adding that lens, that patient lens to the quality and safety work and improvement work and processes that we have in our hospitals. As we move towards experience-based co-design, there is a huge element within the organizations about culture, right? And culture, as we know, eats the strategy for the breakfast, lunch, and dinner, right? As said by many experts before. So I would like to ask Dr. Passant from her experience at working across various healthcare systems and also collaborations with multinational institutions about the value of culture and why organizational culture is really important when it comes to enhancing patient-centeredness. Dr. Passant.
Thank you, Dr. Abid, and thank you, Dr. Newera and Dr. Augustine, for your inputs. Actually, cultural improvements improve also and enhance the patient's outcomes. This also can affect or increase the level of satisfaction and overall satisfactory experience for the patients. But there are some key components that need to be followed through which we can enhance this experience, including, and as I'm adding on what Dr. Newera has highlighted, acknowledging and valuing the staff contributions and fostering the interdepartmental networks. Also, promoting the employee engagement as well as involving the patients and their families in the decision-making processes. There is also an important point that we need to follow throughout this process. We need to establish patient and family advisory councils and provide staff empathy training, which is an essential component and essential strategy to enhance the culture of patient-centeredness. This is in brief.
Yeah, I mean, thank you very much, Dr. Passant, for highlighting some of the very important aspects of cultural improvements, right? And where we look at as an organization, which really values patient-centeredness at the core of it. And I must say that patient and family advisory councils and committees across different organizations remain a cornerstone. They demonstrate a commitment of an organization towards patient-centeredness, right? However, at the same time, as we were discussing, that there is a role of staff, there is a role of the healthcare workforce that we have, and what capacity and capability they have in terms of improving and providing patient-centered care and enhancing the patient-centeredness across their organization when it comes to, providing high-quality healthcare services. So I would like to ask Dr. Augustine about his experience in health system strengthening and working with the front lines, how crucial it is, and what role really capacity building plays when it comes to improving and enhancing patient-centeredness. Dr. Augustine.
Yeah, thank you so much. So I'll mention the time Dr. Passant for highlighting the importance of culture and values within the system that helps strengthen the patient-centeredness care. This just means that for us to keep the culture going, for us to create continuous awareness amongst staffs on the culture of the organization to ensure patient-centeredness, we need a capacity building program that would reinforce that would continuously bring the awareness of culture to the employees. And so capacity building programs play a key role in ensuring that patient-centeredness within the healthcare system, it's almost or always being adhered to. It helps nurture and sustain the culture that Dr. Passant talks about, and also keeps the knowledge and skills of the patient or of the staffs always to that level. That would always ensure that they are enhancing their knowledge and skills that will provide a better understanding of the patient's needs and preferences. The key role that capacity building also plays has to do with the fact that culture has to do with organization or with behavior change as well, and the application of that change within the system. And so capacity building programs, in a way, helps us to always ensure that the staffs and the clinicians that within the organization are always being checked in terms of creating that awareness within the behavior that needs to be changed, and how that behaviors are informing or enhancing the care in terms of the patient-centered care that we want to provide as an institution.
Yeah, I mean, like, thank you, Dr. Augustine, for highlighting the importance of capacity building. Really, staff capacity, remains an important area to enhance and empower, providers and engage the staff within the healthcare context, right? By increasing this capacity towards the patient-centeredness and patient-centered cares among our staff, we are also looking at engaging them better, which also improves employee experience, which really is linked to the patient-centeredness and high-quality healthcare services as well. Now, as you know, we are moving towards this era and advancing rapidly in the current era of digital health, right? And artificial intelligence, and all these new uh, gigs and everything that healthcare system is trying to adapt and adopt currently. I would like to ask Dr. Ahmed Newera from his recent experience on some work around the role of digital patient engagement technologies and how we can leverage digital technologies that we have, and where do we stand when it comes to the artificial intelligence and all these new uh, technological advancements, and how can we really use them to enhance patient-centeredness in the healthcare systems and when it comes to the care of the patients. Dr. Ahmed, please. Uh, Dr. Ahmed, could you unmute yourself? Thank you.
Thank you very much for the question. As you mentioned, now we are in the era of the artificial intelligence, and every day there is a very rapid progression in the tools, and this is what makes the patient is always have high expectation and high demands, and they are not now satisfied with the traditional ways or old ways of so our as a healthcare institution, we have to cope up with this new modalities. And also this new modality is giving us like a mobile application and the portal and telemedicine platforms is give us opportunity to get a feedback from the patient and make them more engaged. But one of the issues which we meet in our hospital that is just need to be organized, and because once you started, you will receive a gush of information. You need to how to analyze it or how to respond to everyone. And also, I guess there is still also some debate of the artificial intelligence use in some specialties in the medicine. Like in radiology, like in digital in safety of the radiation safety and these things. So this is still challenging, and still there is a lot of to be done in this, but it's a good opportunity to use to get input from patient as I say.
Mhm. Right. I mean, like, we can definitely use it as technologies and advancements to engage patients better, right? Having
Yeah,
those automated text services available to them based on the disease journeys that they have. For example, if they're going for some knee replacement surgery,
yeah,
as a basic example, we can set up algorithms that are linked to the patient records,
yeah,
and they're linked to the patient journey throughout that
yeah,
process until he receives its surgery and then goes back through recovery. And we can have those reminders coming into them, prepare them better for this surgery, and then can have them go through a lot of additional things that they can in order to support them and educate them, and continuously engage the patients. And studies have also shown that these things over the last few years and about the last decade have led to improvements in the overall outcomes of the patients. So definitely, as you've mentioned, there's a lot of hope towards the enhancement of patient-centeredness and patient-centered cares with digital technology and AI. However, there is always those risks, as Dr. Ahmed
yeah,
has
sure, yeah,
highlighted as well. So when it comes to patient privacy, patient data, and all that, so healthcare systems need to also look at those things, cautiously
yeah,
when it comes to the use of
yeah.
enhanced use of the technologies. Thank you, Dr. Ahmed. And which brings me to a really an important next question. And I know that that is one of your areas of expertise as well, Dr. Ahmed, that I'll really want to pick your, your thoughts about it, is really about how we can, measure patient-centeredness, right, through in a comprehensive manner. As it is well said, you cannot improve what you can't measure. So very famously, this has been said, right? So would you please like to tell us and the audience and the colleagues across the healthcare quality and safety world
Sure.
about various measurement frameworks? Thank you.
Okay, sure. It's always about, hospitals speak about value-based healthcare and how much we will pay for the service and how much it will cost us. So, and how we give the best service with minimal cost. And this is the most aim of the quality and the healthcare. So what we always hear about this is a patient-reported outcome measure. It's a PROMS, which is all of us know it, which is mostly focused on the outcome, the outcome measure of the patient, like surgical site infection and glycated hemoglobin, and what we see at the end of the journey of the patient. So, but what we have now is when we have patient experience, and it's patient reported experience measure, so it's called PREMS. So this is was focus more on the experience of the patient, the communication, and the access, and the care coordination. So I believe, as we in the healthcare, we shouldn't focus only on the patient reported outcome measure. We have to also, get benefit from the patient reported experience measure, which we give us more insight about the patient journey. And also, it's proved that when we use both together, it's more beneficial for the healthcare system to measure it. And also, there is one of a new framework. It's called a Kirkpatrick model, which is measuring the patient-centered capacity building by measuring the reaction of the participant and the learning outcome and behavior change and the ultimate result achieved. So this also can combine with the PROM and PREMS together with in our measurement of the healthcare system. So we have to combine all this thing together. So we finally get the true measurement of our healthcare and and to achieve the best value based healthcare.
Yes, definitely. I mean, like recently, there were some reports from various global quality commissions back in 2018, late 2018, and there was a lot of variations mentioned when it comes to what really patient-centeredness means and how to measure them across different parts of the world. By, as Dr. Ahmed, you have mentioned, by using PROMs and PREMs and as primary measures to think about when it comes to the patient-centeredness, healthcare systems can very well, align themselves towards these measuring of patient-centeredness domain and dimensions of quality. And again, as you've mentioned about capacity and capability building, that is also very important because organizations do look at return on investments when they are trying to work on capacity and capability building programs. Excuse me. Thank you very much, Dr. Ahmed. By this, I would like to move to the next question, and I know that that is towards Dr. Passant. And really, I want to ask you, Dr. Passant, from your experience, in the editorial fellowship, right, and and across the medical publication world, what role do you think that we as medical publishers, as journals, as academia can play? This brings me to one of the very important questions, and really looking at the experience from the JQSH as an editorial fellow, Dr. Passant, I would like to ask you about how we as medical publishers, as journals, as academias, can enhance patient-centeredness in the healthcare, through the medical publication world.
So medical publishers are playing a crucial role in enhancing the patient-centeredness in terms of facilitating the patient engagement in the research processes and also ensuring the availability and accessibility of different medical literature that could provide evidence-based information for the patients to access. whenever needed. So there are different platforms that are available now in terms of and providing actually medical information that is valuable. However, not all of these platforms are providing evidence-based information, and some are falsified also. So we need to increase the availability of the materials that are evidence-based, and increase the accessibility of free resources as well.
Great. And as we have discussed previously, as well as among ourselves as fellows, that patients can also be part of the peer review process of the manuscripts, as well as they can play a role in the editorial boards of the publishers, right, of different journals as well, and that may enhance the quality of the work that is being published, and also make it more patient-centered, right, and bring that clinical research and translate into clinical practices and better outcomes as we move forward. With that, I really want to thank this panel of my esteemed JQSH co-fellows for the editorial fellowship. Dr. Ahmed Newera, thank you very much. Dr. Augustine and Dr. Passant for your input through this very engaging panel. One of the key messages that we would like to give you as a part of this Patient Experience Week panel is that a lot needs to be done when it comes to patient-centeredness in healthcare, right? We are talking about a microsystem where individual work happens, right? And then improvement capabilities and capacities are very important when, as highlighted by Dr. Augustine, we're talking about improvement frameworks, right? When it comes to experience-based co-design and many other various improvement methodologies integrated to a better measurement frameworks. And then it comes to policy changing and macro level change, macro system work towards enhancing and engaging patients and providing them better care, so that we can comprehensively say that the healthcare system is really patient-centered. With that, I would like to end this panel and really thank everybody, and thanks the audience. Please stay tuned to the JQSH, as there will be an accompanying editorial coming soon about patient-centeredness that will be linked to this video. Thank you very much. Bye-bye.